Always good to have Dr. David Klein stop into the studios. He represents and owns, as a matter of fact, the Stages of Life Institute in Longwood, Florida. Today, we're going to be talking about pain, the hand and the wrist. How many of us warriors who come here to Central Florida want to get active? We want to get out there and golf. We're playing softball again. We're hitting the bocce ball, whatever we're doing. And I'm telling you right now, maybe it's a pickleball. And we start having these terrible aches. We're on the computer for a few hours with the grandkids. The arm hurts, the wrist hurts, even some of our fingers are hurting. What's going on, Dr. Dave?
Well, here's the problem, okay, and that's that we wear out. We have joints. They're very much like the joints in your car, the hinges on your doors, and like anything else, they're not really intended to last forever. And when you use the same joints, when you use the same extremities, when you do the same motions over and over and over again, the tendons that surround these joints, the ligaments that attach to the bone, tend to become inflamed. They tend to become painful. And so you're going to look at it and you're going to go, my God, why should my hand hurt after 18 holes of golf or 36 holes of golf or rolling 3 or 4 games in the bowling alley? Well, what happens is that repetitive banging, repetitive jerking of these tendons against the bone will cause what's called micro fractures or micro infarcts or micro irritations. These little areas become inflamed. Pain ensues as the development of swelling, and guess what? Now you're gimped up. It doesn't work out so well. So what are the different types of problems that can lead to hand pain? Because we're going to focus on the hand for right now. Well, number one, okay, you're going to think in terms of carpal tunnel syndrome because that's what some jerkweed told you that you had. But most of the pain that you see in your hand and wrist actually comes from the elbow. Okay, well, what do you mean? Why should I say something as stupid as that? If it hurts at the wrist, that must be where the entrapment is. Well, consider the following. The nerve that leads, the sensory nerve that goes to the tips of your fingers, passes through the carpal tunnel, truly enough, right there at the wrist. But it goes deep to the elbow and up to your neck, and it's all one cell. One cell from the spinal cord to the tip of the finger or the skin where it ends. So when that nerve gets irritated, why would it hurt in one location instead of hurting along the whole route? That doesn't make any sense to me, and it never did make any sense to me. Yes, it's true that you can become irritated and have pain at the wrist, but it's not going to come from the median nerve itself. But what can do it? There's a ligament that transverses the carpal tunnel that does become irritated and frayed. When it starts to get inflamed, there's something called nervi nervorum and nervi vasorum. These are small nerves, very short, little segmental nerves that innervate the blood vessels and innervate the nerves themselves. When these become irritated, that's when the pain happens. So going in there and cutting through the carpal ligament may not make any sense at all, when in fact all you might need to do, all that might be necessary is to treat those little teeny tiny superficial, mindless, meaningless little nerves without individual names no less, with a topical anti-inflammatory and a topical anticonvulsant. How will you know if it's going to work? You apply it, and if it's gone in 60 to 120 seconds, you know you're right. What does this do? It avoids surgery. Now, carpal tunnel surgery is rather benign. Maybe not. Okay, about 1 in 10 of these fail. What does that do? It leads to number 2 carpal tunnel release, and many of those fail. Why is this? Because it may not be coming from the carpal ligament at all. When folks have hypothyroidism, carpal tunnel syndrome is typical. You can expect to have carpal tunnel syndrome if your thyroid's not working.
Wait a minute. There's a big bunch of difference there.
You think? Okay, we are talking 2 very different teams in the Final Four here. You with me? Yeah, one is endocrine and the other one is neurological. But if you have hypothyroidism and carpal tunnel syndrome and you go ahead and you cut through that ligament, you stand a very reasonable chance of developing something called double crush syndrome. What does this mean? It means you insult the nerve proximally with the endocrine issue, the hypothyroidism, and then as soon as you insult it surgically, now the nerve doesn't heal, and you can become crippled up. And there are people out there that do all the time. This is bad news. So how do you fix carpal tunnel syndrome, quote unquote, in somebody with hypothyroidism? You treat the thyroid, for God's sake. How does this work? Because when your thyroid is too low, hypo, under, active thyroid, the nerve will swell, and it swells very, very gradually, very, very modestly, but just enough. It's as if your finger passing through a ring were jammed. The finger will swell against a fixed ring, and guess what? It can cut its own circulation off, and that's exactly what happens at the carpal tunnel. So those of you that have been told, those of you that think, those of you whose hairdresser told you, oh, gee, this must be carpal tunnel syndrome, you'd better consider one other thing, not just hypothyroidism, but what about tendonitis at the elbow? Okay, those of you that golf, okay, have heard of golfer's elbow. Those of you that play tennis have heard of tennis elbow. Those of you that have played both sports may not have heard about either. God knows, you don't have enough time to read. But here's what happens. Golfer's elbow is tendonitis of the medial epicondyle. That's the medial portion of the elbow. These muscles run from that location through the carpal tunnel into the fingers and gives you the ability to grip your golf club, grip your tennis racket, or grip whatever's in front of you. Okay, it grips all kinds of things, some mentionable, some unmentionable. But the fact of the matter is that the muscle of grip, the flexor carpi ulnaris, can become aggravated, inflamed at the elbow and cause hand pain. Very, very common. Gee, I have a hard time lifting things up. I have a hard time opening a jar. What else will do that? It's not just the hand. It's the muscles of extension of the hand that originate in the lateral epicondyle tennis elbow. You have a hard time opening a doorknob? Okay, can't twist open a can of pickles? I will tell you, the most likely possibility there is lateral epicondylitis. God help you if you go ahead and get checked out with an NCV or EMG, and you're going to find out that you're going to get operated unnecessarily. So what do you do to fix these things? What do you do to diagnose it? The NCV and EMG may be something worth doing. We do them all the time to rule things in and rule things out, but you never do them unilaterally. You never do them on one side alone. Well, gee, my right hand is numb. You'd better have them both checked out, because if your median nerve is entrapped on the right and it's also entrapped on the left because of your thyroid, it's not causing your hand pain. Okay? You know, why would it be numb on one side and not on the other? It defies logic. Yet these yahoos will go out there and do NCVs and EMGs on one extremity, have nothing to compare it to. It makes no sense. It's bad science. It's bad medicine. And it yields and nets out unnecessary surgery.
I know that later in the week we're going to do a show on, the financial edge of staying healthy and using nutraceuticals and going to over-the-counters and all that sort of thing. But there's so many people I know in the villages, surrounding communities, even Orlando, and they'll come down, they'll get active, and they feel like it's joint pain. And the first thing they do is watch the 8 o'clock show on TV that's trying to sell them glucosamine and chondroitin.
Okay, well,
and they're rushing right out to get it.
Oh, you got to love it. Okay, glucosamine and chondroitin sulfate, MSM, are marvelous substances if used appropriately.
There you go.
But glucosamine, okay, the junk that's out there is mostly glucosamine hydrochloride. Doesn't work. Glucosamine sulfate is what you need. So going out there and buying junk doesn't do you any good at all. What's more, what joints respond to that combination? The hip, the shoulder, and to a lesser extent, the knee. So if you're looking to do this for your hands and feet, you're out of luck. It's not going to do you any good. Now, it might not do you any harm, and it might be helping something else, but it's not going to do what you think. But the individuals that come into my office, gee, my fingers hurt. Okay, my favorite one's the thumb. So they think, oh, it's got to be arthritis because it hurts in the morning, it aches, it does this and it does that. But more times than not, it's something called de Quervain's tenosynovitis. And this is a tendonitis, guess what, of the same muscle that causes tennis elbow. It's the same problem. Tennis elbow, pain at the elbow, tennis elbow, pain at the wrist, called de Quervain's tenosynovitis. And you don't operate on these.
Sounds like a tennis player, not a tennis
Well,
helmet.
it could be. If you're not holding your racket properly, okay, it will lead to both. You have to hold your racket properly, address the racket, as the coach will say, hold the racket firmly, and let the ball hit in the center of the racket, and you too can have a pain-free experience. If you don't, it doesn't end so well.
Now, we put these 10-minute segments in a lot of places, and we're going to increase where we put them. But that seems to me to be the only place people can find this information.
In the tennis court?
No, about a whole lot. All this stuff. Chondroitin, tennis, pain, everything.
Well, hopefully that will change.
All right, very good. Robin, what do you got?
Well, I think you can find a lot of information on the tennis court. Our phone number is 407-679-3337. Our website is stagesoflife.net. Our office hours are Monday through Thursday, 8 to 5, and the health store is open during office hours. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And we're also on Facebook at Stages of Life Medical Institute.